Rural communities face persistent gaps in healthcare access, quality, and outcomes. Patients are often treated far from specialty centers. Clinicians work with limited resources, and delays in diagnosis and coordination can have life-altering consequences. Meet Viz AI, the first multimodal imaging and generative AI platform. Now, Viz AI's AI care pathways directly address these rural care barriers. Viz is the most widely deployed clinical AI platform in the United States, supporting more than 230 million lives across 2,000 hospitals, including community and rural hospitals that need fast, reliable decision support the most. Viz AI care pathways are deployed across neurology, cardiology, oncology, pulmonology, and trauma. Here's how Viz AI care pathways work. Imagine a rural hospital with limited on-site specialty coverage. Dr. Smith receives a secure notification on her phone about a patient with signs of stroke on his brain imaging. She immediately reviews the patient's brain imaging directly from her device, as well as a chart summary. Viz condenses hundreds of pages of the EHR into a summary, highlighting key elements from the patient's history. By combining EHR context with imaging, Viz provides Dr. Smith with a unified clinical view, comparing the patient's presentation against clinical guidelines to surface care considerations, next steps, and transfer needs. After reviewing, Dr. Smith uses Viz's HIPAA-compliant communication tools to connect with the nearest comprehensive stroke center, initiating a consult with a neurosurgeon in a single tap. Now, the patient has the same expert eyes as if they had arrived there directly. Both the spoke and hub teams can review the same imaging, access the same clinical context, and align quickly on whether transfer for thrombectomy is appropriate. The imaging also goes back to PACS for accelerated radiology review and documentation. With confidence in the clinical picture, the care team can initiate transfer quickly, knowing the patient needs a higher level of care. The result? Faster alignment, fewer unnecessary transfers, and earlier access to life-saving treatment for patients in rural communities. Only Viz AI combines imaging AI, generative AI, and multimodal clinical data into one seamless experience for all hospitals. Together, we can strengthen rural care delivery and help community hospitals deliver high-quality care no matter where patients live.